I'm Nicole Copeland, and I am the Director of Physical Therapy for First Settlement Physical Therapy in McConnelsville, Ohio.
I'm Rachel Yearwood, and I'm a physical therapist assistant at First Settlement Physical Therapy in McConnelsville, Ohio.
I'm Mina Bailey, and I am the Office Manager for First Settlement Physical Therapy in McConnelsville, Ohio.
When patients come in for physical therapy, they should expect to have a good workout, but also be able to have fun, and really they should expect to start feeling better after they see us.
When a patient comes in for therapy, on their first day, they'll see me and I will do their evaluation, which consists of just receiving their subjective and finding out what is bringing them into the clinic, taking some objective measurements to find out where their impairments lie, and then setting up a plan of care that's personalized to them in regards to those impairments. I take the time to discuss that plan of care with the patients on the first day so they know what to expect as far as timeline, and then from then on out they'll come in for treatments to treat those impairments that we have identified on the first day.
I'm responsible for getting people scheduled and getting their reports and different things for their surgeries, helping them get on the schedule, and just taking care of the little things with the clinic.
I think patients are most surprised about the small town family feel of the clinic and the atmosphere. It's nice going someplace where you're familiar with the people because they're from the area, and you're familiar with some of the other patients because you know them personally or through the community, and I think that also helps with the therapeutic atmosphere, that patients know that they're in this together, and it helps with their overall care.
So when patients come in for physical therapy, I think they'll be surprised by how much fun they actually have. We're actually a pretty goofy group down here, so we get their treatment done in a really fun and effective way.
My favorite part of coming to work every day is just meeting new people and getting to know people. Sometimes you don't have the time to really interact with people that you see on the street that you may have grown up with, and being in here gives you a little bit of that time to get to know them.
It has been wonderful coming back to a community in which I grew up in order to give back to the community, work with the people, families and friends of which I know from growing up around this area. So that has been very rewarding, living and working here again.
It's great that I work in a clinic in an area where I've grown up, because you get to see people that you may have known while you were growing up, and now you get to help make a difference in their lives.
A lot of our patients, because we're in such a rural area, have a lot of problems with transportation. And one of the things I'm able to do is get the transportation set up for them for every appointment if that's what they need, and to get them the resources that they need to be able to have physical therapy.
One of the biggest differences we've probably seen in a patient's care was a gentleman who came in a wheelchair, and by the time he was done with us through therapy was able to do planks and high-level dynamic activities, and so to see that progression was pretty awesome and very rewarding.
We have patients coming in, whether they're in a sling or a wheelchair, however they enter, and then when they're done with therapy, they're actually back to work, or they're back to living their daily lives and are able to have fun and enjoy their life like they're supposed to.
I think my favorite thing about coming to work every day is the fact that I do get to work in an area that I not only live but grew up in, so I have a strong connection to the community here, and so I enjoy seeing patients in the clinic and then going out in the community and seeing them live their everyday life and knowing that we had a part in helping them get back to that.